going to start off today with our keynote speaker, or our guest speaker, sorry, who is Dr. Peng he's the Vice Director of Research and Cooperation from the division of BGI, which is the Beijing Genomic Institute. He has extensive experience in bioinformatics and NGS data analysis, and he's leading a team who focuses mostly on working with research institutes and industry, incubating 5 new products for BGI. Yes, and the sorry, we're waiting for the presentation to come up. There we go.
Okay, thank you. Thank you for the introduction. It's my great honor to be here to share a topic with you. Okay, so my topic today is to decoding the gene of life. I'm from the BGI, a global and genomic companies from China. So, what is the life, and where does the life come from? The Bible told us the God created the human by the dust. And in the Chinese legend, the goddess Nuwa created the man also by the dust. So what is the dust of the life? We know that the dust is the basic element of the life. Of course, I'm not going to tell the story about myth and religion. The scientists have the answer. That is, the dust is DNA. And it has the double helix structure. And in each strand, it has 4 types of letters. We call it nucleotides. And it is A, C, T, and G. And DNA is the universal language of life. Viruses have DNA, bacteria have DNA, and so do human, mouse, chicken, and so on. The only difference between all the species, that is the length and the order of the nucleotides. So for these familiar phenotypes, for the eyelid and tongue and our skin, that's all determined by the genes. So how many genes, and what about the function of the genes? The Human Genome Project, it is one of the last biggest scientific projects in the last century. This project, the scientists aims to tell us how many nucleotides and what's the function about all the nucleotides. So what does a human genome look like? Just like what we see in the screen, ACTG, ACTG, about 3 billion nucleotides. That is, how long is it? If we read the nucleotides, 1 nucleotide per second, that we need totally 100 years. If we read faster, 4 nucleotides per second, that we also need 25 years. So it takes the scientists about 13 years and $3 billion to sequence the first human genome. And luckily, to date, it only needs less than $1,000 and 1 day to sequence a human genome. So because of the rapid development of the technology, so we can fulfill lots of dreams that cannot be achieved on the past days. The first dream I want to share with you is if I can see. So this young man, that is the author of a famous song in the Chinese, that is the If I Can See. So it describes the dream of a blind man who wished to see in their own eyes. And please look at this American boy. He was born in the 2000 and with a very rare disease, that this disease can cause the blindness. And he was almost completely blind when he was 8 years old. And after an injection of genes that can deliver the lipid pigment, so on the back of his eyes, and 1 year later, he can read the text and play basketball. And if I can hear what will be happened, and this age it has a name called the Southern Bodhisattva. It's very beautiful, but we know that 18 of these 20 actresses, they were blind when they were 2 and 3 years old because of used the wrong drugs. Because they carry the mutations of genes with the similar mutations. If use the wrong antibiotics, it will be deaf. Luckily, to date, we can carry out the newborn genetic screening to discover these mutations. Only need less than $30. And please look at this picture. It's a brother and a sister. The brother is 16 years old, but he has a mental retardation. Even for the simple calculation, 5 and 5, for example, 3 and 5, he didn't know the answer. And this little girl is the sister of this brother. She's very famous for her songs. He won a lot of fans in the China. And this little girl and the boy, they all have the same disease that is called the PKU. This disease will cause the mental retardations, just like what we see for this brother. Luckily, this disease, if we can discover it at a very early stage, for example, in the newborn for the newborn baby within the 72 hours, and give the right treatment, and eat the food, avoid protein, it can develop normally. So just like the lovely girl. So nowadays, about more than 30 to 50 conditions can be detected in the newborn screening test. Also less than the $30 in the China. So how about the cancer? So we're all familiar with the Adrienne. She has a faulty copy of the BRCA genes, so she decided to remove the cancer and ovarian to reduce the risk of both these diseases. And at the other hand, it's also a very famous song star. Also, she is the spokesman, image spokesman for the cervical vaccine and cervical cancer. And the cervical cancer is also the only cancer that has the clear cause and can preventable by the vaccine at a very early stage. Okay, so this is for the women's cancer. And as we know, that the tumor is a disease of DNA. So can we give the right drugs to the right patients based on their genetic differences? The answer is yes. And this is what we do in the precision medicine. And Gleevec, it is one of the famous targeted drugs that can cure the different cancers, for example, the leukemia and the GIST. It's just because some of the patients have the same targeted genes, so they can be cured by the same drugs. So we know that for the tumor treatment, it is not only based on the what organs was involved, also depends on the what the gene was involved. And Opdivo is also another effective drug that can treat the different cancers, but the mechanism is different. It can increase our immune system's ability, for example, to help T cells to recognize the cancer cells more easily and then kill them, and then so can cure the different cancers. And another story, as we know, it's very necessary for the pregnant women to do the health screening for the babies. And one of the tests is the Down syndrome test. This syndrome also will influence the brain development. And if we want to detect this disease very accurately, in the past, a needle is inserted into the abdomen to detect whether the fetus have the genetic difference. So is there a safer method For example, just need the maternal blood? The answer is yes. Today, a new method called non-invasive prenatal testing can be used to detect Down syndrome very accurately. The sensitivity and the accuracy is also more than 99.9%. Nowadays, more than 4 million pregnant women have received this test, and about 2 million was performed in China, and about more than 1 million was performed in the BGI. Okay, it is a fiction time. So in the film Star Wars, we all know that the Force is a magical power. When the Force awakens, we get the magical power. So I wish may the Force be with you. And it's indeed, everyone has the Force. I think in the biology, the human stem cells is one of the cells that contain the magical powers. It can differentiate to the different cells that with the different functions. And the scientists use human stem cells to transplant it into the human patients to improve their visual capabilities. And this discovery was published in the top medicine journal, Lancet. And 2 years later, in Japan, it was approved to cure the patients. So very magic. And then finally, go back to the first slide. The God created the human. And today, the human, we can create the leaves by the DNA. From the 2003, the first virus to the first synthetic cells. And this year, the scientists announced that we initiate a project that aims to synthesize all the human nucleotides, perhaps as in one day. Maybe we can synthesize one human by ourselves and send the genetic code through the radio and traveling at light speed, perhaps within 4.3 minutes. At Mars, we can receive the code and synthesize a new man in the Mars. Time is limited, and still have lots of interesting stories and discoveries. And I welcome you to go to our headquarters, BGI Shenzhen, China, and also have lots of stories and discoveries to share with you. Thank you.
Dr. Peng, thank you for sharing your experiences with us. BGI is one of the top companies of its kind in the world, and today we're going to be discussing how we can support and nurture companies, similar companies that are helping people live longer and live healthier lives. I'd like to introduce our panelists today. First, we're going to start out with Shwetank Verma. He is an innovator at MetLife and Lumen Lab, where he drives forward new revenue opportunities and broadly focused and being an entrepreneur within a larger organization. Prior to joining MetLife, he was a serial entrepreneur in healthcare and innovation, so he has a number of experiences that he can share with us today. And David Lim is a co-founder and general partner at Biotech Capital. He has more than 20 years of experience in private equity and investment banking, and he serves as a senior investment advisor at the Asian Healthcare Fund. And then my colleague, Chang Liu. He's the managing director of Singapore, mainland China, and Hong Kong for Access Health International. I'll be moderating the discussion today, and I manage the Access Health Singapore office, where we are a catalyst for healthcare innovation across the lifespan with both public and private partners. So starting, a question for David and Shwetank. What is the company or the company that you've either started or invested in that you're the most proud of in the healthcare space?
Okay, thanks for having me here. Well, it's one of those questions that's kind of like, who's your favorite child, right? It's very hard to answer, but I would say that good companies have certain characteristics that you see across the board. I think number one is the CEO is always 24/7 on. This is a person who's always thinking about what he can do, what he should be doing, engaging with all the stakeholders, whether it's investors, customers, and building the culture in the company and so on. So I think that's really important. I mean, every time we look at a company, the technology attracts us first, but in the end, it's really all about the team.
Yeah, so just to add to Damien's point, so it's as you said, it's very hard to pick one when you've been sort of associated with over 50, and I'm sure he's been associated with more. But for me, other than the thrill of the startup ride, it's the social impact that really matters. So if I had to, if you put a gun to my head and I had to pick one, it would be the sort of social enterprise we had started way back in 2008, doing primary care for the urban poor in India and then across Africa. That had a significant impact on improving health outcomes for people who were otherwise unable to afford or access healthcare. And that, sort of showed ripples across the economic life cycle, which are quite nice to behold.
And what do you think, this is the big question that I think everyone is looking at trying to answer here in Singapore, is what does it take for Asia? And for Asia, we're really thinking about Singapore, India, and China as prime markets. To have more successful biotechnology and medtech companies similar to BGI, and what are the roles of both the public and private sectors in successfully supporting these companies?
Okay, thank you for the questions. I think I would like to tell what is in the China. For the India, I think center would be have the more good answers. I think it's important first to we have the new innovations. For example, for the case what I have showed in the non-invasive prenatal testing, you have to have the original, the new technologies, so that you can develop the application very quickly. And the second, I think the culture of the company is very important. You have to encourage the young people to try it and to do the research, encourage them to make mistakes and then find the right answers. That's what I think is very important.
Actually, there's a follow-up question within there. As you're saying, helping encourage young people to take those risks and encouraging them to make the mistakes. How do you think we should be doing that? Because I think there's a lot of times we want to encourage people to take risks, but there still can be impediments to doing that. What have you found to be the most effective in helping people to take those risks?
Okay, if you do not take a risk, you do not try it, you will not find the right answers. Yeah.
Yeah, I think, it's not so hard to get people to start companies these days. There's so much hype about entrepreneurship and so on. So you see a lot of scientists that are really willing to take the plunge. I think maybe the two things that I see which are maybe a little scary number one, some of them don't know where they stand globally, because you cannot just benchmark your technology locally. I mean, you need to have something that's globally competitive. And then the second is whether you're operating in an environment that can support a startup company. And that varies for every country. I mean, if you look at the US, even today, the Bay Area and Boston are really the two centers of innovation. San Diego is still very far behind, for instance, and then the Research Triangle, they tried something, and that didn't quite work out. So you see, even a country like the US with such a long history is so difficult. When you look at small countries like Singapore, we have a very small research base. There are one university, our two universities is really less than the UC cluster, for instance. Right, so how much IP can come out from this two leading universities? So I think people need to have that sort of framework in mind, that context when they're starting companies. I've met professors who, even after I sign an NDA, they won't even tell me what their technology is because they think I'm just going to start a company, which is completely wrong. So I think there's a lot of learning that has to go on.
Maybe if I can speak for China and the region I'm looking at, I found that there are actually two major trends in health I see in China in the last 10 years. One, every governmental officials are thinking about healthcare reform. So everywhere you see the policy reform happening in health. And the second thing is every investors are switching to investing in healthcare more and more. Now in China, I say about 1/3 or 1/4 of the investment are looking at into the healthcare field. So this is because of the demographic shifts, the aging population and the general more demand for healthcare as economic growth. And we found that actually it's really not, we're lacking money in this field. Healthcare is generally, in China for instance, every other sector is we call oversupply, but in healthcare it's still the supply will never feeding demand. So I think Damien, you just mentioned more on the technology side, but I mean if it's just more service and product-based companies and innovation, there's definitely a huge gap and opportunity there for the local innovators. But I think what is lacking here is smart investors, I would say, because in China there's so many money rushing into this field, but most of them are building high-end hospitals, buying nursing facilities, but it's really catering for a very small fraction of the market. So but they do that because they don't know much about healthcare. So really, how can we educate and giving directions to those money, both in the governmental public sector as well as in private sector, and to create that ecosystem to facilitate and to help the promising startup and innovators grow. I think that's something are much needed in the region. Thank you.
Yeah, just to add to Chang's points, of course you need sort of savvy investors, but one of the key challenges in a startup ecosystem is mentors and the people who've done it before you. So as an entrepreneur, the key sort of sometimes thing that's missing is somebody who's been in that position of building a business and to be able to guide you when there are no right answers, just be able to sort of hold your hand and show you the way. And I think that's something that all these markets are struggling. There's not that many first-time entrepreneurs who've made it, who can play it forward, who can be the mentors, who can be the people investing in the next round of entrepreneurs. So a lot of these entrepreneurs are coming up and starting from scratch and doing it on their own and figuring it out on their own. And that I think is one of the biggest differences in the ecosystems between the US and Southeast Asia as a whole. But that's something that will change as all these first-time entrepreneurs succeed, and hopefully the next round will find it easy to carry on.
I would say that's something that even personally we can talk about within Access Health as well. I mean, we're fortunate that at Access Health we were the second office, so we can learn from our predecessors. And we're constantly trying out new things. I think we fail every day at something, and then we find the little magic ingredient that actually works every day as well. You mentioned that we need more educated investors, and you're speaking really from the point of China, and then across Asia, needing more mentors as well. Do you think there's an opportunity, what do you see the opportunities for potentially investors who are trying to come into Asia? We know a number of companies and investors want to enter Asia, whether they're doing that through Singapore as their gateway to Asia, or if they're going directly to India or China or other countries in Southeast Asia. What do you see as the opportunities there for them and the best way for them to enter the market?
If I can start, I see great opportunity in that. I think there actually a huge gap in the Asian market. We're looking at India, China, and ASEAN comparing to the more matured Western market in health. And I think actually both multinationals and international innovators and investors can play a role in this. That's why I see here in Singapore, for instance, more and more multinational corporations like Lumen Lab, like MetLife is setting up their innovation centers here. And I think that really provide a very great bridge of the global marketing research and understanding about the healthcare sector and to match into the local needs. So I think having a more sort of engaged community of leaders from the multinational innovators, the local investors, and the innovators, the startups, both coming from the region, but also coming from outside, want to enter into the region to develop partnership among each other. That might be one of the solutions.
I think for the founders out there who are sort of talking to investors, I think one important thing you need to remember is even if your company is not in China or India, you should talk to investors everywhere. Because eventually you want to go to these markets. And what we're also seeing is investors from these countries are coming out of their sort of geographical focus for various reasons. They want to get into companies earlier, or valuations are too high in their home country. So, I mean, I would encourage you to talk to everyone just to get a better sense.
So I think your question was what can investors do, look at, and how can they sort of enter these markets? So I think one of the key things, of course, is for investors to start looking outside the traditional stack of investing in healthcare, like hospitals, diagnostics, clinic chains, etc. Look at digital health, look at mental health. These are fantastic opportunities. And as Chang said, the other opportunity is really partner with local assets, which can help you understand the market and enter at the right point, at the right valuation, all of that. So find out a way to bring some local expertise to bear on your side, and then look at non-traditional investments.
I have a question for the investors. We know that one challenge in the past for investors who are coming into healthcare space or are new to investing in healthcare is sometimes having a reduced patience for the longer return on investment. Have you seen this change as more investors who are maybe coming from outside of healthcare, trying to enter healthcare, are they starting to show more patience for that long-range return on investment versus immediate return on investment? Or do we still have a ways to go as far as working with and educating the investors so that they understand this is a long game?
I can speak to that. The short answer is no. I think investors have a very sort of short investment horizon. They look at if a taxi app or a delivery app is going to make them 3x in 2 years, they'll rather do that than do a drug or a medical device that's going to take 5 to 7 years and have regulatory cycles that they have to face and so on.
Yeah, just to add to that, I think as an entrepreneur, you have to be very careful as to whose money you take. So somebody who's never done a healthcare investment, you'll have to spend a lot of time educating them about the way a healthcare investment plays out. So it may not be the best thing to do. So it's very hard for somebody who's outside the industry, and especially as Damien mentioned, when there's so many exciting opportunities looking outside the industry, to be able to sort of understand the uptake of even digital health solutions, which take a longer time to ramp up than a hot viral app that can grow very quickly. So yeah, be careful as try and take people who have healthcare experience when you're starting out.
So you'd recommend that entrepreneurs interview and vet their investors as
Absolutely.
much as possible, especially if they're in healthcare?
Absolutely. See the portfolio, talk to the former entrepreneurs that they funded. You're getting it's I mean, more or less like a marriage, right? So especially if it's an early stage investment, so you want to do your DD as much as they're doing their DD on you.
If I can add one more point, I think, Damien, you're really speaking on behalf of private equity and the pure financial investors. I think also adding to echo what Shwetank said, I think in earlier stage investment, like VC seed funding round, you really need the investor to be your partner and who really can be a help, not just financially, but moving the company along. But for instance, in China now, it's a great opportunity I see in the later stage that now a lot of listed companies are looking for new sort of buzzword or a new target, and it's very easy for them to raise money from the capital market. So that actually becoming some more patient money, and they are even willing to be educated. For instance, there are quite a few leading local pharmaceutical companies we know in China who are dying for innovative drugs. It's not necessarily they need a return right away in 1 or 2 years, but they might be a very valid long-term strategic investor into the later stage. So this time, I think the startup needs to work very closely with the early stage investors like Damien to together sell their deals later to those big guys.
Another question, what particular advice would you have for scientists who are still working within the universities or the research institutions, or clinicians who are working within hospitals, and they're going to start a new company. They have an idea for a new product or a new service. At Access Health, we work with a number of the regional health clusters, and we work with the universities and the polytechnics as well. And we know that a lot of great ideas are coming out of these institutions because people really understand what the needs are on the ground. They have the most intimate knowledge of the challenges and what the solutions are. And for them, it can be even riskier to start something new because they know how to do what they do every day. What have been some of the most important components for people who have successfully made that jump from either scientist during the day to being an entrepreneur, or for someone who's gone from clinician to entrepreneur?
If I can speak to that, I mean, most people will tell you never to fund a startup with an academic as a CEO. We've had a different experience with that. We had two very successful companies that were started by scientists, and they became CEOs and they went public. And it was still the same CEO that went public with the company, which is very unusual. So those may be exceptions, but I would say for most scientists, I would say know your limitations and then get help where you need. Business development, drug development, you may be good at discovery, but you have no idea what clinical development is. You need to get help in that. IP, for instance, you've never met an investor in your life. You've got to go and do all these things and sort of get out of your comfort zone.
I totally agree with what you said, actually. But I think there's very much successful cases, like also BGI, I know it's also funded by academics. But I think you need really that ecosystem support in this stage, and the early stage investor, I think, is that there is a key. And for the professor, is also how much they're willing to give up their pride to be able to work with a team instead of just individual.
And then as one final question as we end the session today, in one sentence, what would you give to entrepreneurs in the region who are creating their startups?
It feels like this is Aladdin and the genie. 3 wishes, what would you have? I mean, I guess the simplest...
We will give you 3 sentences if you would like.
Yeah, 3 sentences would be just give them access to mentors, and that's like one of the biggest things that I think is missing in the ecosystems today.
Okay, please invest yourself. You are the most valued person.
I agree with that. I think you have to believe. If you meet an entrepreneur who believes, I think the investors can sense it.
Please follow Access Health and our partner's new initiative called Health Futures. Thank you.
Thank you very much for taking the time to speak with us today. And we have questions that came up through Pigeonhole as well. We have 2 minutes left officially. How do you build trust within the health tech ecosystem? I'm not quite sure exactly what the trust were. I haven't perceived any distrust yet, so I don't know where the trust will be built, but how do you...
I mean, trust, apart from, of course, the word that is most linked with trust these days is blockchain, but I don't think that's what they're implying here. I think being transparent, the classic case here is maybe Theranos, which didn't sort of publish its results, didn't build trust in a transparent, ethical way. So all startups that are playing in the medical field need to make sure that they have clear ethical guidelines, clear policy of publishing results, and a clear way of reassuring the public that what they're doing is sound science and not something that's ego trip of a CEO.
Anyone else have comments on that question? Okay, unfortunately I don't think we have time for any more of our questions for Pigeonhole as we're running out of time and we want to stay on schedule, but thank you everyone, and
Thank you.
Standing session.